Hello, my name is Jackie Davison. I'm a research officer working for the search team based at the Sachs Institute in Sydney, Australia. Before I begin, I would like to acknowledge the Gadigal people of the Eora Nation, whose land I live and work on and where I'm presenting from today, and pay my respects to their elders past and present. I would also like to acknowledge all other Indigenous people who are listening to this presentation today. SEARCH stands for the Study of Environment on Aboriginal Resilience and Child Health, and is Australia's largest long-term study of the health and wellbeing of urban Aboriginal children. SEARCH is a long-term partnership between researchers from a number of institutions, the Aboriginal Health and Medical Research Council and 4 Aboriginal community-controlled health services. The study I will be referencing today was undertaken in 2 Aboriginal communities participating in SEARCH in the state of New South Wales in Australia. So throughout this presentation, I'll be using the term Aboriginal. While 57% of the Australian Aboriginal population lives in urban areas, data suggests only 10% of Aboriginal health research focuses on the needs of Aboriginal people. Obesity and chronic disease in Aboriginal people are a major contributor to the increased burden of illness over the wider population in Australia. Recent data show that around a third of Aboriginal children between 2 and 14 years of age are either overweight or obese, with rates increasing rapidly in early childhood around 5 to 7 years of age. Around 20% of Aboriginal people living in non-remote environments reported running out of food and not being able to afford to buy more in the previous 12 months, compared to only around 3.7% for non-Indigenous people in similar circumstances. A large body of evidence exists highlighting the negative impacts of food security on health, particularly obesity and diet-sensitive chronic disease. Food security needs to be seen as part of the intrinsic part of the food system. Initial consultations with our 2 partner communities in New South Wales, in urban southwest Sydney and in Wagga Wagga in regional New South Wales, confirm that food insecurity is a serious issue in these Aboriginal environments. This project sought to better understand the systemic factors contributing to food insecurity in urban Aboriginal communities and to identify barriers and potential systems-level interventions that could improve food security in this population. Community-based systems approaches to assessing, addressing and monitoring food security are becoming better understood, accepted and utilised in health research and practice. A range of formal and informal tools exist to support these approaches. The highlighted tools on this slide reflect the system tools used in this project to date. I will now very briefly discuss our use of them in the context of this project to address urban Aboriginal food insecurity. Firstly, we did key informant interviews with Aboriginal community and local stakeholders in the 2 partner communities where food insecurity was identified. An initial thematic analysis of this data suggests the importance of structural factors, including financial disadvantage, proximity to unhealthy food outlets, past and continuing over generations factors, including the ongoing impacts of colonisation, also strategies for coping and community strength-based solutions. Another tool we used in this project was community-based spatial food resource and food access mapping. This map, which is unfortunately turned horizontal so you can fit it on the screen, is one of these maps. You can see the relationship between selected Aboriginal households in the community and their access to food. The yellow houses on the map indicate the general location of search study households, with other icons and symbols representing community transport access routes, fast food outlets, supermarkets, schools and other resources. This map can be continuously updated by community. It provided a good shared visual understanding of the challenges many households, especially school children and families, face in terms of access to healthier food options and the spread of fast food outlets in particular. We then turn to group model building. Group model building is a means of engaging diverse stakeholders. It's in a process for jointly understanding and addressing a complex issue. Over one or more sessions, a model is built of the situation in the form of causal loop diagrams. It's a collaborative effort and a facilitated process is mostly used, involving several scripted group exercises to develop a visual depiction of the relationships between parts of the system. This is a photograph of the group model building process that we facilitated using scripts from Peter Hoffman's resource on community-based system dynamics, which many of you might be familiar with, to produce a causal loop diagram of local urban food insecurity as experienced by Aboriginal community in Tharawal, southwest Sydney. And this is the causal loop diagram of Aboriginal food insecurity produced at the Wagga Wagga Group Model Building Workshop, produced by the participants, including Aboriginal community controlled health service staff, local Aboriginal families and elders, local health district staff, representatives of local NGOs and food relief charities, and some local education representatives. This CLD emphasised access to healthy food, social and cultural influences, financial and income limitations. Many of the factors identified in the thematic analysis are able to be linked together in this map. The discussions that led to the construction of this CLD identified some specific system reinforcing loops or drivers. For example, the one which I'm pointing to now, including the demand for healthy food, which was strongly linked to available income. And which impacts again on cooking resources, which then determines the impact on demand for healthy food. Several other subsystem loops were also identified in this map, meaning many of these variables are endogenous or being driven internally by multiple factors. An interesting loop in this map is the role of the lack of communication and increased competitive food amongst food relief and welfare organisations on the dependency of food relief. Using these system tools has assisted in building a shared perspective of food insecurity as experienced by Aboriginal people in urban settings. Other tools continue to be used in this project to further address and monitor food security initiatives within these communities. And in finishing, I'd just like to say thank you especially to the leaders, staff and clients of our two partner Aboriginal Community Controlled Health Services, Tharawal Aboriginal Corporation in southwestern Sydney and Riverina Medical and Dental Aboriginal Corporation in Wagga Wagga. Without their support, this project would not succeed. Thank you.